Hey, what's up, Unbroken Nation? One of the things that I fear so many people have come through traumatic backgrounds like me is they go, I have no control over this, and my life is a disaster. This is how God made me, and I must suffer. And I argue, well, that's not actually necessarily true. But one of the things in the lack of control is we seek to find it. And unfortunately, especially in this society, we seek to find it through prescription medication. We seek to find it through things that are not actually to our betterment, to the vices, to the drugs, the sex, the alcohol, the things of that nature. Where does control of your own mind really play a role in this?
So this is also you asking amazingly good questions. The control is one of those words that when someone and you can really relate to this, and anyone who's listening who's been in a dark place, and including, I mean, we've all got our stories. When you're in the depth of despair, the last thing you feel like you have is control, and that's often where support from others comes in. But then there might be cases where you're in a situation which, Michael, I don't know your full story, but just knowing, working in years of trauma with people, sometimes there is no support. And so therefore you really are on your own, and you can't really see things, and at that moment you do feel complete. I mean, a child who's constantly being abused or going through the most horrific things, where's the control there? And so that then is a child that will go into adulthood with most likely the coping mechanisms to protect oneself, which is, maybe they had to learn to fight back, or, as you say, numb the pain with anything that takes away that pain, and then enter us into our current society where people's stories are no longer really heard, except in a few environments like, the work I do, what you do, etc. You go into the traditional biomedical system, of which I've been a part, but not in. I do it differently, obviously, as we're practicing clinically. I'm coming from a different angle, but the traditional system is one of, okay, well, tell me your symptoms, and let's find you a diagnosis, and let's give you a treatment. That works beautifully for cancer and diabetes and brain tumors and things like that. But when it comes to a complex childhood where there's been excessive trauma, just giving you a label and a medication is not going to fix the problem, because you have a whole bunch of these in your head that make you feel overwhelmed and out of control. So it is a slow process of educating and learning to dive deep introspectively into your wise mind. The wise mind, that inner knowing that got you out to where you are now, where you now are so in a state of wise mind, Michael, that you reach out and help others. And so that process of is a process of empowerment. And it's a cyclic thing that happens over time, and it can be multiple ways. Either someone comes in your life and actually starts helping you, or you reach that rock bottom point and you manage to actually help yourself and pull out of it. There's different ways that it will happen, but hopefully most people reach, and according to the research, oopsie, my little tree's falling over, 3/4 of people will actually reach the point that you have, where they've gone through complex trauma and will get through it with lingering effects. But those lingering effects do not have to be the effects that live with you for the rest of your life, because our current now biomedical model messaging is, okay, well, you are depressed because of a broken brain. Your brain is damaged, and that's it for life. So therefore, you need medication to fix it. If you have diabetes, you need insulin. So type 1 diabetes. So you get insulin, it restores it, it heals the body. If you have a pathogen like a virus, like COVID virus, we now have antivirals that can start fighting it. So we can fight it like that. When you have a bunch of toxic experiences, it's as real as a COVID virus. COVID virus is made of protein. So is this experience. It becomes a protein tree-like structure in your brain. So your immune system is going to fight this just as much as it would fight the COVID virus. So this is very deep what I'm saying. Experiences from any stage of your life don't just they're not wishy-washy go away things. They are physical, structural, protein, chemical changes inside of your brain that look like trees. This is a thought tree that has lots of roots and branches, which are memories. So memories of the experiences coalesce into a thought structure. So this is a collection of a lot of data of what happened, the source over there, and the processing and the interpretation, the different parts, what happened, how you've processed it and coped, and in the interpretation, and how that shows up in your signals. So when this is dominating, when we look at life through this, we do feel out of control. And the control comes back in as we realize this and we get to that point, and it's different for everyone, and it's got different, as I mentioned. Sometimes it's a person that says something to you, or you read something, or people have said they've been on a train and they've seen a sign in a subway, or someone said something to them at a shop, or they just one day just had I don't know exactly what your revelation was, but there's something that shifts. And when you get that shift, instead of this, there's a little bit of this, and then you start climbing up. And what I've tried to do with my work is help people to do that climbing in a way that doesn't make them go backwards, and in a way of understanding. Because to rewire the networks, to take the power out of this and make it small and rebuild healthy new thoughts, where you still remember your story, but no longer does it control you. You are controlling your story, which is evidence in your life. That's not going to happen in one day or with a medication. The medication is not going to fix this. You don't have a brain disease. Obviously, your brain's affected. And I've done a ton of research, and in my latest book, I do explain this, and I have images, and I show my clinical trials in a very simple way, and I have a very simple way of explaining how to do all the stuff I'm telling you. But essentially, this is not the cause. The cause, this in your brain, is not the cause. The cause is what happened to you. This is the manifestation. So the thing happens, the mind experiences the experience that goes in the brain, and the brain and body show up in a messed up way. Obviously, everything you have, the mind needs to use the brain to experience it. So obviously your brain's affected, but it's not the cause. It is the response. So as we manage our causes, as we identify and deconstruct and reconstruct the causes, so we rewire the brain. Full circle back to one of your first questions, which was neuroplasticity. Because of the neuroplasticity of the brain, this work I'm telling you, where we focus from our signals to the thought, to the root, reconstruct, etc., daily, 15 to 25, 45 minutes a day over time, and I'll tell you the time in a moment, that is rewiring the brain. Neuroplasticity for trauma which is the main focus of your podcast, and for anything, building habits, breaking habits, etc., works in cycles of 63 days, not 21, not 1, not 5 minutes. The medications, like the psychotropic drugs, they're not even medications, they're actually drugs. And they're drugs that numb your pain or numb the feelings, but they're not fixing anything. They're making structural changes in the brain that may make you feel better and may help you cope for a time, but they're not going to solve the problem. They may ease it for a time so that you can face and start dealing with issues, but you need to know the side effects. And sometimes the side effects create more problems than what you actually need. Now you've got more problems, brain damage problems on top of the original issues. So, when it comes to psychotropics, it's really important that you fully understand what you're getting into, and that you ask your doctors for the document that they should be giving you of exactly what these are, how they work, their addictive properties, because they're all addictive, and how to withdrawal effects, and to understand that when as you are going through a process of facing stuff, it is painful. And numbing that's not going to help you. You've got to go through the pain. It's called the treatment effect. You're going to get worse before you get better. I've had some patients that start this process, and there's actually one of the stories in my book, Cleaning Up Your Mental Mess, of one of the patients in my clinical trial, who at day 1, no identity, totally depressed, etc. Long story short, by day 21, they were saying things like, I'm not depressed anymore. Day 1, I'm depressed. That was the identity. Life's falling apart, everything you can imagine going wrong. Doing this work daily for 15 to 45 minutes, and we can talk about in a minute what it is. By day 21, they were saying things to us when we brought them back into the clinic to do the evaluations and so on, the brain, blood, narrative, everything. They were saying, I'm not depression. I am depressed because of. That's a massive growth. Then they also said this, but I feel more depressed and more anxious, and I'm having panic attacks, and I'm grieving, but it's different. I'm actually feeling human emotions, and those are valid emotions because they're starting to see what the pain was from. They had suppressed childhood trauma. In this particular case, this person had gone through terrible childhood trauma and had managed to suppress it for all these years and kind of function, but was falling apart. And because these are volcanic, eventually they will explode in your life. Eventually these things will explode. You can suppress for a certain amount of time, but they will eventually explode. And that's what had happened in this person's life. And so they started shifting, but by learning to get control back slowly in these cycles, they started seeing increased depression and grieving as an element of control, because they said, okay, I know I'm depressed because of, I can see that what I went through, so therefore I should be feeling depressed. That's a very normal human response to those terrible things that I went through in childhood or whatever, and grieving the lost time. And I mean, I'm sure you can relate to this, Michael. So that's growth. But in this society, the minute you feel those, oh, you're sicko, there's a disease coming back, you don't have a disease, you're trying to process life experiences, and it will get worse before it gets better, but then it does start changing. And this is why it's so important that you work for the beyond 21 days. Everyone says 21 days. It's not 21 days. 21 days does a major shift. It'll bring things up, and you'll start seeing the changes, and you'll start building a new way of thinking, etc., etc. But if you don't push on for another 42 days, that new little thought is way too small to override this one. You need the extra energy taken from this and put in so that this becomes nice and big and strong. And I'm going to put two next to each other so you can see it becomes nice and strong. Only when the new thought is nice and strong, which takes another 42 days, totaling 63, are you then going to remember your story, but you're not going to be functioning from your story. You're going to be functioning from the new way of thinking. And that process brings control.